When we talk about improving the health and well-being of African Americans, we have to include mental health awareness. Often, there's a stigma about mental illness in the African American community. Next month, the Detroit-Wayne Mental Health Authority is holding a conference to educate the community and religious leaders about mental disorders and substance abuse. My next guest is the Chief Medical Officer at the Detroit-Wayne Mental Health Authority, Dr. Carmen McIntyre. Thanks for being here.
Thank you.
So we were just talking in the previous segment about the difficulties getting African Americans to know what's available for them in terms of general health care, mental health. It's the same thing, and here you're facing an additional hurdle, which is a lot of times people don't want to talk about this.
Absolutely, absolutely. Stigma is a big issue, you know, and stigma meaning it's a mark of weakness, but I think stigma historically having a special significance for African Americans because the archaic term meant a brand.
Right.
And, you know, as slaves, we were branded.
Right.
So I think, you know,
so there's that history.
There's that history there. Absolutely.
Forward and making people think twice about wanting to even acknowledge what's going on.
Right.
Yeah.
So, you know, you'd already mentioned earlier the disparities just in general health care. So I think one of the important things is for people to realize that the vast majority of mental illness and substance use disorders are also medical problems.
Yeah, right.
And stop thinking of them as somehow a weakness or, you know, something wrong with you morally.
Right.
They're health problems like diabetes that you should be able to mention and seek treatment for without embarrassment.
That sort of old trope about, well, I'm just depressed or I'm just feeling down and I can get over it, really is not the way to confront these things.
Yes, you're absolutely right about that. And all of us are going to have down times.
Yeah,
you know.
Right.
So that's absolutely
But what we're
normal.
talking about is something more profound and again related to a medical issue that prevents you from being able to live your life normally.
Yes, so that's what through this conference on August the 19th and 20th, we're hoping to start helping people know when something is maybe more than just the blues, and know when to refer people for help and where to refer them for help.
Where to get it. Let's start about how to identify those things. What are some of the things people ought to look out for as signs that somebody's got a real mental health issue as opposed to just being down?
So a lot of times when people think of mental health issues, they think of, you know, schizophrenia is shown in the movies. Yeah. You know, something really bizarre.
Popular media does not help with the depiction.
It does not. It does not.
Yeah.
But really the most common ones are anxiety disorders and depression. So we all know what anxiety feels like. We all know what having the blues feels like. You know, it's a problem when it starts interfering with your functioning. So it's a sunny day out today. It was easy to get out and get about and get your day started. If it's a rainy day, you know, we drag a little bit, but we still go to work or we still go to school or we still cook and clean the house and whatever. So when your symptoms start interfering
when you stop
with getting things done, yes. And that's something people can look out for, a change in the people that, you know, in their family members or the folks that they work with. Yeah.
And then so now let's talk about what you can do. Wayne County now has this mental health authority, which is separate from county government, which is where mental health services used to be housed. How much better is the access now for people in the county?
Well, you know, it's something we continue to work on. The Detroit-Wayne Mental Health Authority is going on 2 years old, so we're still relatively new. But we are working on improving access. First of all, access is centralized. So if anybody has questions, you want to know if somebody needs help, you're trying to get yourself or someone else help, it's one number. So 1-800-241-4949. So it's the way just to get information. It's also the suicide hotline. It's also the way to get someone into treatment.
Right.
So we have that. And then we're really encouraging our providers to do what's called same-day access. So the concept being that it took a lot for me to finally admit that maybe I need help.
Right. Don't make me wait.
Don't make me wait. Don't tell me an appointment's 2 weeks down the line. So really encouraging our clinical providers to say, if I'm ready today, I can walk in today.
In terms of providers, we used to have a pretty extensive state hospital system that's been dismantled over the last 20 years. some people say that was the wrong choice. Some people say that was the right thing. I think even people who defended the system thought that in those hospitals we were probably not doing the best job that we could. How different does that look now? What's taken the place of those state hospitals, and is it enough to treat the population?
Right. You know, there was a somewhat controversial paper written recently by Dominic Sisti and others talking about the return to the asylum. And we certainly at the Detroit Wayne Mental Health Authority don't advocate the typical idea of an asylum.
Right.
But there is a recognition.
So this was a paper recommending that we bring back that
Well,
form
the thought was that maybe we went a little too far in emphasizing community treatment, and that there are some people that really need long-term treatment.
Right.
So at the authority, we're following the example of the Centers for Medicaid and Medicare Services that says we really need to focus on community integration. And in the Community Mental Health Act, which was actually JFK's last signed legislation, that emphasis was there. So we're talking about from the 60s. We're not talking about a new concept, but something we've never actually realized.
Right.
So yes, let's get people out of a hospital setting, but what's the alternative in the community?
How do they get services if they're not in that setting? Right?
And it's not to go to segregated, you know, mental health and substance abuse sort of treatment facilities that are out in, you know, the burbs somewhere where you don't see
isolated.
them. Isolated, absolutely. So we really want to have people get their treatment in the same communities where they expect to, you know, live, work, and play.
Right.
So, you know, yes, hospitals are necessary for some folks when there's acutely a danger to themselves or others.
Sure.
Sometimes some folks need longer term care, and it could be in a residential setting in the community.
Yeah.
The problem we have right now is that in Michigan, licensing says that you can't lock those units.
Right.
So when you have someone who doesn't understand the need for treatment or is that confused that they might wander away from treatment, we end up keeping them in state hospitals for a long time. It'd be great if we could have them in the community where they want to be, where their families are, you know, just be able to keep them in that facility.
So is that a legislative challenge?
That's a legislative
challenge.
Just
a rulemaking. So we've got to get the legislature to think about that.
100%.
Yeah. Let's talk about the Affordable Care Act and how that has changed access to mental health services, and particularly in the African American community. In the previous segment, we talked about how many African Americans now get access to insurance that they didn't have before.
Right.
There's got to be some ripple effect in mental health too, I would imagine.
Sure, absolutely. So we know that it seems like by and large the racial disparities in healthcare probably fall into three things. Genetics is one, but genetics is not all of it or even most of it.
Right.
Then there's the access because of poverty and whatnot. And then there's cultural issues and education. So the genetics for things like schizophrenia, that's going to be the same across any race.
Right.
Depression and anxiety disorders, however, when you're in an unsafe neighborhood, you don't have enough resources to live.
That surround Black people's lives.
So that's absolutely going to increase things. So we know that access to health care through the Affordable Health Care Act has gotten a lot more people insurance.
Yeah.
And we do have to applaud our current administration here in Michigan at getting the Healthy Michigan expansion to Medicaid, where a lot of other states didn't pursue it. So we have found a lot more people have that access. The trick is they have the access, but we haven't maybe done the best job at advertising who we are, how to get our services.
Yeah.
So that's what we're trying to do by our collaborations with faith leaders and churches, with primary care organizations, and trying to get out just to regular stuff like ethnic festivals and whatnot. Let people know we're there.
Yeah, yeah. How can people participate in the clinics, the conferences that you're having in August?
So August 19th and 20th, it's our Faith and Mental Health and Substance Use Disorders Conference. So it's our first annual. We hope to make this the first of many.
Right.
And the 19th, we're really trying to target for faith leaders, okay? But the 20th is open to all.
It's open to the public.
And both days are free. It's being supported by a grant from the Michigan Department of Health and Human Services. And a great thing that we did in the last fiscal year was integrate substance use disorders with the rest of behavioral health.
Oh, very good.
You know,
Yeah,
because
right.
there's huge overlap.
Yeah.
No reason to treat them separately.
Yeah.
So folks can participate on either day. It's at general public on the 20th. It's at the University of Michigan Dearborn campus.
Okay.
Free.
Yeah.
Come on board, hear things like the importance of spirituality, but when prayer might not be enough.
Right, right, when you need help. Okay. Dr. McIntyre, thank you for being here.
Thanks for having me.
Yes.